The power in Launch Together is that it's really pulling in the strengths and the knowledge and the resources from so many of our partners. This is long-term, sustained, and really supported work in communities across our state to really connect all the places that intersect with young families, educational settings, child care settings, primary care settings, behavioral health folks. Let's connect all of those so that we can really stack the odds for supporting young families with better outcomes. What's unique and what's actually powerful about Launch Together is that it's now this collaborative of 8 of our community funders. 8 local funders have come together. And so instead of kind of elbowing the way into work, it was actually linking arms for this, where there was this collective intelligence and agreement on what can we do to impact in a positive way the lives of young people and really young families. Where Rose Community Foundation has become so important is that in this kind of very early knowing that this needed to be done and be somebody, a backbone, if you will, somebody to really hold the intention of this work. This vision actually is not available to us without program officers and leadership inside the Rose Community Foundation having a long view. How are we able to hold this work in a way that we can be patient and wait for some of the long-term outcomes? And that's the vision of Elsa Holking inside of the early childhood programming, and then also Whitney Connor at the Health Committee that I'm involved with so closely. So the leadership and the partnership that we were able to see demonstrated between both the health and the early childhood committees, where Elsa and Whitney came together to say, wow, what would happen if our committees came together and really began to see a kind of linked strategy that would take this work forward in a really kind of dynamic and hefty way, if you will.